Hello, everybody, and welcome to the last of our Advocacy Day series. And this webinar today is teaching you everything that mental health advocates should know as far as advocacy in Tennessee. And we have with us today Bill Dobbins, who is our lobbyist for NAMI Tennessee, and he is joining us from the Cordell Hull building, which is where the legislative committee meetings are and where the legislative offices are. And I am Elisa LaPulp. I'm the Policy and Advocacy Director for NAMI Tennessee. So thank you so much for joining us. We are recording this, so people who haven't been able to join us today can watch it later. But for those of you who are here, thank you for your time, and we'll go ahead and get started. Again, if you do have any questions, just put them in the chat box. Let's see. Go ahead and get started. I'm going to share my screen. Let's see. Okay, my screen is frozen. Mm-hmm. That's always fun.
There it is.
There we go. There we got it. Okay. So this presentation is what mental health advocates should know. And right now we are in the middle of our legislative session here in Tennessee, and it started in January. And Bill, can you just kind of walk us through real quickly how the legislative session is structured, like what they're working on now, when it might end?
Certainly. Again, welcome everybody. I'm Bill Dobbins. The Tennessee General Assembly is a 2-year session. We're in the second year of this 112th General Assembly. The General Assembly will convene in the second week of January each year, and they'll run through their legislative session and will normally adjourn anywhere from the end of April through the end of May, depending upon the number of bills they have to vote on, other issues that may come up. But their target date is to adjourn sometime late April through late May. And again, the bills that they are debating now, if some of them are not resolved, either approved or defeated, at the end of this legislative session, they'll all go in the trash can because this is an election year. And then next year in 2023, they'll start the 113th General Assembly. We have a bicameral legislature. We have a House of Representatives and a Senate. We have 99 House members, 33 Senate members. So right now we're about midway through this second year of the General Assembly. A lot of votes have been cast for the last 2 weeks, and the legislature is trying to kind of clear the deck so they can work on primarily the financial aspects about the state's economy and its bills, so they can eventually adjourn. But they have another 6 weeks left at least.
Great. Thank you, Bill. And the idea that we're trying to convey to you is what areas of advocacy that we cover, like how important our mental health advocacy is to so many areas of the state. And we hope to just give you a glimpse of that and then give you some encouragement for how you can get involved in as far as advocacy. As I mentioned earlier, you can go on our website and see our previous presentations during our Advocacy Day series during this month of March. And you can see our presentations on how to tell us your story, how to be an effective storyteller, how to tell your story to legislators, policymakers, and then also how to become inspired and have some confidence around being an advocate. So you can click on those on our website, which is at namitn.org. So what should mental health advocates know? So some of the areas that we touch are criminal justice, schools, insurance, commerce and labor, healthcare systems, mental health care, state budget. And as an advocate, you don't have to be an expert in each one. What I am advising people to do is to pick one area that you're really interested in. There's many other areas that can be brought into the mental health discussion, like health disparities, LGBTQ, and mental health care there, access to care, communities of color. What I'm hoping to do is give you an idea, and so you can walk away with some inspiration and encouragement for maybe getting involved in one or two areas where you feel comfortable and maybe you've interfaced the mental health system. So we'll start with criminal justice. The idea behind criminal justice legislation that NAMI gets behind is we want legislation that promotes help, not handcuffs. We are very involved in a program called Crisis Intervention Teams, and it's called CIT. It was founded in Memphis 40 years ago after the police shooting of an individual in Memphis. And the Memphis Police Department partnered with NAMI Memphis and other stakeholders to create a police training program that educates officers on how to respond to individuals in a crisis. And what that has developed into over the years is a community program that brings stakeholders together and gives the law enforcement officers and first responders resources for where they can send people for help in a crisis. So there's a 40-hour training for the officers, and then they've got some support from this community coalition on where they can send people for help. These coalitions include schools, hospitals, treatment centers, housing officials. And so that's an example of where criminal justice policies would help people with mental illness. So this year, we don't have any legislation around that, but I wanted to give you just a sense of what a policy area around criminal justice would be. So there are efforts to divert people from the criminal justice system into proper care. And one of those bills is a bill that's being promoted by the House Speaker, Cameron Sexton, that would create more mental health courts throughout the state. Bill, do you have any comments about that bill in particular?
Right. This bill was sponsored by the Speaker of the House and also the Speaker of the Senate has thrown his support behind this legislation. And what this bill will do, it will create 9 or 10 additional mental health courts in Tennessee. We have 9 mental health courts in Tennessee right now, and these courts deal with people who have during a mental health crisis have committed minor crimes, burglary, theft, trespassing. And so now they're in the criminal justice system. And rather than punish people for having a mental health crisis, these courts were developed to help direct that patient away from the criminal justice system and back into a normal functioning society. The courts will work with that patient to make sure the patient is getting proper care, proper health care, making sure the patient has a place to stay, is living, safely, has made restitution if there's been some damage caused by that person during their mental health crisis. And the ultimate goal is that by a person entering into this diversion program under mental health court, they will avoid any jail time and will end up having their records expunged. So it is a more proactive way, a more effective way in dealing with people in a mental health crisis than just throwing them in a local jail and then bring them into a court of law and find them guilty of these minor infractions that will end up compounding that person's life by affecting their ability to get work, to get housing. So this is a very proactive way to approach people in a mental health crisis. That really is a smart way from a taxpayer standpoint. It saves local tax dollars by not crowding our jails, by not crowding our court systems, and getting people in a mental health crisis in the help that they need.
Yes, perfect. That's great. And because it is sponsored by the House Speaker, that's a pretty good chance of passing.
Yes.
And so that is certainly a bill that NAMI Tennessee and our grassroots advocates would get behind. But sometimes there are bills that we really don't like. And
That's right.
I'll go into a couple of these here. Well, so there is the death penalty bill. Now, this is one that we would support. These two bills would prohibit capital punishment for individuals who committed a crime while they had a diagnosed mental illness. And certainly that's something that we would support, but those bills are not moving, meaning that they haven't been sent to a committee for a hearing. So unfortunately, that's not going to go anywhere this year. That bill has come up several times in the past.
Right.
And then another bill, and actually I started working on this with a coalition over the summer, is extreme risk protection orders. And this is an awkward position to be in. And what this bill would do is allow law enforcement and family members to petition the court to have firearms removed from the home of an individual who poses a substantial harm to himself or others. And while that sounds great and would be something that we could potentially support, the bill contained very troubling language. It said that the family and the law enforcement could petition the court just to remove the firearms solely for the reason that somebody has a diagnosed mental illness. And that is stigmatizing to individuals with mental illness. And there was a coalition that wanted to promote this. It's a gun safety coalition over the summer. And we had to say, I'm sorry, NAMI Tennessee can't support this because it discriminates against individuals with mental illness. And that bill actually failed in a committee meeting earlier this month. So Bill, do you have any comments or thoughts on either one of those two?
No, it's I was just looking up that bill, and it was what we call taken off notice. Let me see what it was. Hold on. It got, and this was last year, Senate Bill 15. Oh, I'm sorry, I was looking at House Bill. I got the wrong bill number. That's Advocates 101. You need to learn which to get the correct bill number, because if you don't, you'll be running down rabbit holes you never knew existed. So let's see, that bill. Yes, it failed a couple of weeks ago in a House committee hearing. So no, it's if NAMI did not get behind it, there was not enough support in the House subcommittee to support it either.
Yeah.
So yeah, that bill is dead for the year.
Right. And generally, any bills dealing with gun control, that's a really dicey issue in the state.
Yeah. So
yeah. Okay, so another area is education, and it's been a lot of activity around that this week. So BEP funding. So BEP's Better Education Plan funding. That is the formula that the state uses to give money to school districts to run the schools. It's based on teacher pay. It's based on the number of special needs kids in schools, so many different things. It hasn't been changed. The formula hasn't been really evaluated or looked at since the 1990s. So there was an effort this year. The governor announced, we're going to take a look at this. Where does it need to be adjusted? And there were 7 or 8 town hall meetings held across the state. Would you believe that in almost every one of those town hall meetings, the need for mental health in schools was among the top ranked issues that came up statewide? And what that looks like is more funding for school counselors, psychologists, social workers, mental health supports. So this picture here is a advocacy alert that I sent out to our grassroots advocates. We've got about 9,000 people on our list, and we were encouraging them to submit some comments to the Department of Education and Governor Lee about the Better Education Plan funding and how it needs to be more supportive of mental health. So we're really happy with that. So that discussion is taking place. There's different bills that would address BEP funding for school counselors in particular, and social workers. And we don't know what that's going to look like. Bill, do you have any comments there?
Right there, they do. Again, what we call here in Tennessee the BEP plan is as Elisa said, is a better education plan, and it is a formula that's been around for 30 years now, and Governor Lee is revamping that formula based on current issues and needs, and is now referred to as TISA, T-I-S-A. I don't know what the acronym stands for, and it's being introduced right now. In fact, I left a committee meeting that was debating this bill. It's very controversial. A lot of support for it, but there's a lot of questions about it. When you're divvying up billions of dollars in a different way, a lot of people are going to take an interest in how that money is going to be spent. So the ultimate goal for the governor is to pass this new education formula this year, and that's going to be, and that will be the dominant issue going throughout the rest of this legislative session. Will be this one particular issue, because it has to go through, I think at one count, 11 different committees and subcommittees in the House and Senate. So it will be thoroughly vetted. And there will be changes along the way as they come up. So I don't think it was a perfect plan as submitted, and so the legislature will be shaping it also as it goes through the legislative process. So we'll be watching. But again, as Elisa said, Governor Bill Lee here in Tennessee, when he was campaigning 3-4 years ago, he was touched by the consistent message he heard from teachers all across the state, whether in Memphis or in Bristol in the East. They all said that they wanted more mental health support in the schools. So he got that message, and as a governor, he's been a very strong supporter of mental health in schools and in other programs too. So we're very excited to have a governor to have that much interest in mental health in policies here. In my lifetime, we haven't, well, I take it back, maybe not my lifetime, but in the last 30, 40 years, we haven't had anybody that interested in mental health in Tennessee. So he's been a good partner to have in the policy arena.
Mm-hmm. Definitely. And I feel like this is a good time to mention to people that when you get involved with advocacy in these kind of policy issues, you're dealing with legislators who might not have the same philosophical viewpoints as you. And I think it's really important that we all, especially during this time right now when there's so much political divide, it's really important to look at the issue involved, which is mental health, in this case, mental health for children, and try to set aside any feelings you might have about that policymaker because of his or her beliefs. And if we keep focused on the end results, that's really what's critical in good advocacy. So I did want to mention that.
Yeah. I always tell, regardless who I'm speaking to, is that mental health is a nonpartisan issue, or it can be what we call a bipartisan issue, because mental health affects everybody, rich or poor, Republican, Democrat, Independent, African American, Native American, white. It affects everybody. So it's not defined by any type of ideology.
Right, definitely. So speaking of mental health in schools, this is news that's hot off the press. So Bill and I worked over the weekend on this bill, on these bills, and they were quite controversial. These bills would, well, let me back up. Right now, there are laws in Tennessee that require parental permission for students before they get a mental health screening in schools. So if a child is, or a student is at the age 15, he or she needs parental permission to get a mental health screening. 16 and 17-year-olds don't, as the law currently stands. These bills that I've listed would have required parental permission for 16 and 17-year-olds to get mental health screenings. And why is that a problem? It's a problem because schools are the primary source of mental health screenings for students, and we're creating a barrier to access. Unfortunately, there are some parents who don't believe that mental health problems exist. There are parents who believe that it could be solved by more prayer. There's a stigma, and by some parents, not all, that getting mental health help is bad or a weakness. So we need to create a pathway and keep a pathway for those 16 and 17-year-olds to go to school and feel comfortable for asking for help. We definitely want a family and parental involvement in the student's life. And so these mental health screenings, sometimes it's just a series of 10 questions that are asked by a mental health professional in the schools. And they raise possible red flags if a student might be depressed or having anxiety that could stand in the way of their education. And we believe that these mental health screenings actually empower parents to get their students help. So these bills, 3 of these bills were up today. And Bill, do you want to talk about what happened?
Well, first I want to compliment you. A lot of times, what a lot of advocates don't understand about the legislative process is that sometimes it is a lot of waiting around. It's a lot of the hard work really goes in to when the legislature is not in session. That's when you develop, research, propose policies or propose laws, and you vet it among groups to sound out what are the possible flaws or blind spots when you're developing that language for a bill or a law. And so that's a real basic what I think most people understand about how to write policy and law. But when you get into the legislative process, things can move very fast. And that's where advocacy can really have an impact, because good advocate organizations have to be very nimble in order to articulate that message to its members, to its advocates, and then have the members reach out to their legislators and express that message and ask that legislator to vote yes or no on the bill that's coming up. And it can happen very quickly. In one particular bill, we have in Tennessee is called a mature minor doctrine. It's been in law. Well, one part of the law has been in the law books since 1972 for 50 years. And as Elisa said, part of that mature minor doctrine is getting mental health screenings for 16 and 17-year-old students. Parental approval, prior approval is not required for those 16 and 17-year-olds. They are if they're 15 and younger. And so last summer during COVID and all the stress about that, legislators became aware of this mature minor doctrine or law that's been in the books for decades, and were outraged that 16 and 17-year-olds did not have to have a parent's approval to get things like a mental health screening. It's not a mental health examination, it's just a screening. And a screening can be done by any school professional, but any type of if it is indicative of something more serious, then that child will be referred to a mental health professional. Anyway, so a bill was proposed called the Parental Bill of Rights, with a whole litany of things that parents were expected to have at their fingertips from schools. The bill was amended at the last minute last week, and eliminated this Parental Bill of Rights. And what it was an amendment to remove this mature minor doctrine laws. There's probably 5 different pieces of the Tennessee statute that enshrines this mature minor doctrine. And part of it, again, was for NAMI was a concern. Among the other things that it eliminated was, again, the allowance of 16 and 17-year-olds getting a mental health screening without parental approval. So how an effective legislative policy advocacy works is we get a message out, get a word that something is coming up. We develop a message, and Elisa is excellent at that. We worked on that over the weekend, and we got a paper out that is. I don't know if you can read this, but this is what was developed. And we have NAMI, and we have opposed these 2 pieces of legislation, and we give background and the reason why, and then we emailed these out to all the legislators on these committees, and then we work with other organizations and advocacy groups who had similar objections to these bills. And so we were able, on such short notice, this came up just last late Thursday, early Friday, we were able to get both these bills defeated. One bill, the sponsor took it off the calendar. I think he realized he wasn't going to be able to get it passed, so he went ahead and just what we call took it off notice. And the other bill, the one that amended this bill late, got a motion for her bill, but nobody made a second. And so in Robert's Rules of Order, you have to have a motion and a second to hear a bill. And since there was no second, the bill failed. So it was a what we call a quick death of a bad bill. So, but again, it's NAMI's membership. Elisa, how big is your notice that you sent out? How many members are on that notice?
I probably sent out about 9,000 emails, or like that policy paper and talking points to about 9,000 people.
So we would love to think all 9,000 reached out to their legislators. I doubt it, but that's how you make an effective advocacy group, is getting to know your legislators and them getting to know you and what your issues are. And when Elisa calls her legislator, is going to see Elisa. Oh, it's always about NAMI and mental health, and that's what, as an effective advocate, you want to be whenever you call Mary Smith, your state senator, or Bill Jolly, your state representative. You want them to know that when they see your name on the call waiting or message, oh, it's about mental health, because you're the expert in mental health. These legislators are not experts in mental health. And so you can be their expert and advocate for mental health. So it shows that this is a classic example of how real grassroots advocacy can make a difference in a very short time.
Thank you, Bill. That was like a great overview. And I did get several emails today from people who copied me in on their emails to legislators, and they were amazing, because one individual said that his wife was bipolar, and had she gotten the help that she needed in high school, she might be a different person today. And wow, that's the kind of personal story that goes along with these policy discussions, and they can become so powerful. And we'd like to think that our emails and the policy paper help sway some people. So,
certainly.
Yeah. So advocacy does work, and we appreciate all of you who did write letters, if you're on the call, or emails or make calls, because it does work. So another area, Bill's been involved with this for a number of years, is insurance, believe it or not. So how many of you have tried to get appointments for a therapy visit, maybe to see a psychiatrist, and you were told, sorry, I don't take that insurance, or I'm sorry, your insurance plan doesn't cover this medication? Those are some of the issues that we work on. Parity that deals with federal and now state law that requires health plans, if they choose to provide mental health and substance use treatment and services, they've got to do that under the same rules as they would for physical health. So in other words, if you have to get physical therapy for a broken leg, knee replacement surgery, whatever, that should be on parity with a therapy for a mental health disorder. You shouldn't have two different sets of rules. You shouldn't have to jump through extra hoops, like getting prior authorization or having a different copay, a higher copay, just to see a therapist or a counselor. So Bill and NAMI Tennessee have been involved with that issue for many years. And we did pass some really good legislation that brings some transparency to how health plans provide that care and how they report that. And so that was passed last year. There have been bills filed for network adequacy. And what that means is requiring health insurance plans to have enough mental health professionals to treat patients on the health plan. And that does tie into a bigger issue of workforce. Like in Tennessee, there aren't enough mental health providers out there for a number of reasons, pay being one of them, low pay. And then last is TennCare availability. Tennessee is among the dozen or so states that has decided not to make TennCare, Medicaid, available to more low-income people. And NAMI Tennessee supports any policies that make access greater to mental health for more people. So, Bill, any thoughts, comments on these items?
Oh, well, yeah, the mental health parity has been a real battle, because the insurance industry is adamantly opposed to paying out any more money regardless on your coverage. That's kind of a coarse way to say it, but that's the way I felt after dealing with a lot of these insurance companies. Um, but mental health law, the federal law is been very clear about this. There was the Mental Health Parity Act was passed in, what was it, 1998? No,
Right.
19, anyway, and then in 2021, there was the Consolidated Appropriations Act required that insurance companies are to send their parity compliance records to the Department of Labor and the Department of Human Services for them to review to make sure they're in compliance with the Federal Parity Act. And our bill that we passed last year is to put a little more teeth into in Tennessee. We have the Department of Commerce and Insurance that regulates our insurance industry, is to put more pressure on the department to review these insurance policies as they're required to do, but look more toward mental health parity compliance. So we've been trying to drag not only the insurance industry in this area, but also the state's Department of Commerce and Insurance to get them to do a more effective job in protecting the public, which is what their job is supposed to be. So that's what advocates do. We want to ensure that not only laws are passed, but programs and policies that are already passed and in place are followed through by the bureaucracy, by the administration, regardless of on what party is in charge. We want them to do a better job to protect the Tennessee public.
And this is an issue that's been going on for years. Our NAMI National is part of a nationwide coalition that has been working on this. If you're interested in this topic, if that resonates with you, I would recommend getting involved with the Kennedy Forum. You can Google that. I attend their meetings once a month. And again, as we go along through these issues, if there's something that really motivates you, take some notes and do some research. I wanted to kind of introduce all these areas to you as potential advocates so you can see the potential for getting involved. Healthcare systems is another area. This for advanced practice nurses and physician assistants, there was a bill that would have allowed them to sign off on paperwork in the hospital that would get a person in a mental health crisis involuntarily admitted to a mental health facility. So the idea there is it takes 2 rounds of paperwork and evaluations before somebody can be admitted to a mental health facility. And what the hospitals are saying, this is legislation that was pursued by the Tennessee Hospital Association. They sometimes see people waiting for these evaluations to be done. And right now it requires a physician, a psychiatrist to sign off on all this. And they were wanting legislation that would allow a nurse practitioner and a physician assistant with psychiatry training to also sign off. And Bill, my understanding is that got sent to a study.
Yeah, right, it got sent to a summer study. This is, part of the unfortunately, NAMI and mental health was not brought in on this piece of legislation. This is primarily a battle between the hospitals and the doctors. The hospitals, for better or worse, end up being kind of a dumping ground for people who with a mental health crisis. If they're having a crisis, the family member doesn't know what to do with them. So they take them to an emergency room. They know they're ill. They need to get treatment, but they just don't know where to go, what to do. And an emergency room it normally is not staffed with mental health professionals. And so if a person is in a mental health crisis that warrants hospitalization, they may go to a private hospital, maybe, but and they may voluntarily go. But if they're in such a crisis that they do not know how ill they are, they're out of touch with reality, then it takes two certifications for how that person involuntarily admitted to a mental health hospital, particularly state mental health hospital. And so right now, those certifications are signed by physicians. Now, what was not mentioned in the debate was that the second certification it says to be signed by a physician. It could be a podiatrist. It could be a cardiologist. It does not have to be a psychiatrist. So a knee surgeon could sign that second certification. What the bill as filed would specify that an advanced practice registered nurse or physician assistants who have expertise in psychiatry could sign off on that second certification. It's a complex issue, and most legislators do not like getting wrapped up or caught in between two major organizations like doctors and hospitals. So they end up punting the bill to what is called a summer study, and it won't get studied in the summertime. It was just a polite way to get rid of the bill without hurting anybody's feelings. So this issue will probably come up again, and I will reach out to the hospital association to strongly urge them to include NAMI and mental health advocates in this, because our advocates can bring those personal stories to these legislators to tell them why this would be an important issue. We don't want our loved ones sitting in the emergency room for 4 hours, 10 hours, 2 days, and these are all real times. These have happened, waiting to get help. So that's an issue we hope to get to revisit next year.
Great, thank you. So, and this other bill that I listed, this was passed last year, requiring emergency departments to give like a discharge plan, to give information, referrals to people who come to the hospital after a suicide attempt. So that was something that we really would support. There's no legislation involving this, but we're following this. This has to do with healthcare systems, the 988 crisis line. Starting in July, there's going to be a 988 number like 911, except this one will deal only with mental health crises. And there's been a task force pulled together by the commissioner of the Department of Mental Health and Substance Abuse Services that our executive director, Jeff Fladen, sits on, and that has been talking about recommendations and how to move forward here in Tennessee. And so we're just following the policies, making sure that the way this unfolds is that there's people who, when they answer the call, the dispatchers, they're well trained. We've got mobile crisis throughout the state. We build upon the existing mobile crisis system. More places to go for crisis stabilization and more walk-in centers. So I just wanted to mention that. Mental health care is another area we touch. Obviously, we want quality care. We want early intervention. And the step therapy legislation, these bills are moving through right now. We were part of a larger coalition. The Arthritis Association has been taking the lead on this legislation. How many of you have been prescribed a medication by your doctor for a mental health condition, anxiety, schizophrenia, bipolar disorder, and your insurance company says, no, sorry, we're going to try another one that's less expensive? That's a protocol that's sometimes called step therapy or fail first, because health plans will have you try a less expensive medication. And if you fail first on that one, then you go to another one. And if you fail on that one, you might go to another one. And then maybe your doctor's original prescription will be covered. You have to fail first on multiple medications before you get the one that your doctor prescribed for you. Okay, we're opposed to that process because that is potentially very dangerous to have that kind of back and forth with mental health medications that could have side effects. So this bill creates an expedited system for to appeal that decision by the health plan. So the messaging behind this is that it doesn't eliminate step therapy as a tool. It just establishes guardrails and provides clear a pathway for the most appropriate course of treatment. And that bill has made it through a couple committees already. It didn't get far last year because, of course, who would be opposing this? The insurance plans. And it was a very expensive proposal. There was money, an expense attached to this legislation because of the cost to TennCare. And unfortunately, this bill has an exception built into it this year that removes TennCare from this legislation. So TennCare wouldn't have to abide by this. That does bring the cost of the bill down. However, we're concerned that it creates an unequal system for people on TennCare versus people not on TennCare. Mm-hmm. But it is helping the bill get through. So, Bill, do you want to make a couple comments?
Right. Anytime a bill is filed in Tennessee state legislature, it is evaluated to determine if the passage of this bill will cost taxpayers money. And I think that's very wise. I think it's very prudent to understand any bill that's filed, would it have a impact to taxpayers, and it's going to how much is implementing this bill going to cost. And there's an effort to keep this financial evaluation objective. There's always questions on how objective are they? Anyway, this bill came across with a huge fiscal note of, I think, $70 million because of the cost of including TennCare recipients. By removing TennCare from coverage of this step therapy legislation, I think the coverage drops down to like $100,000 that's going to cost to implement it. So that puts it much more manageable, much more affordable. Legislators did not like the idea of taking TennCare out, but they understood that this may be just a process, and this is just to be part of the pun, a first step in that process on getting this implemented. So I think it has a pretty good chance on getting passed. It's been sent to what they call the Finance Committee in both House and Senate, where it will sit in that and be placed what we call behind the budget. And once the legislators and the governor's office determine what is going to be included in this year's budget, and that includes any legislation that's going to cost money, we'll see if the step therapy bill comes out and eventually gets to the House and Senate floors for ultimate passage.
Yep. So we're keeping our fingers crossed on that one.
Right.
State budget, this is Commissioner Williams giving her pitch to legislators on funding that the governor had asked for mental health. One of that would be pay increases for people who deal with behavioral health on TennCare, in the TennCare program, and in the department's safety net program. So we're watching that as well. Mm-hmm. So this is just something I wanted to remind people as we get involved with policy. We have the power to end the stigma, to educate policymakers about the need for mental health services, and having us talk about it helps end the stigma around mental illness. ways to get involved, like I mentioned earlier, if there's an area that you're interested in and you want to become knowledgeable about, research it on your own. You're the expert of your own mental health journey, and you don't have to know the ins and outs of all the laws. Jen, there's Jen with the little heart. Jen, you want to, so Jen and I were talking before this. She has done her own research on some areas. You want to talk briefly about that?
Yeah. Hey, everyone. My name is Jen. I use she, her pronouns. I'm excited to be here. Yeah, one thing is just like with the internet, it's more accessible, getting on things like NAMI, following different bills, actually learning to, if you get on the capital.tn.gov, all those House bills that they showed us earlier, you can plug them in and you can actually watch video of the bill going on, which is super like helpful to see like what's happening, understand, and just becoming more informed of what's going on. I think the biggest thing for me is learning about how to like talk about it to other people in my community to fight stigma as well. Has been super important. Like language is important. I am a psych survivor and a person in recovery, so it's something I am super passionate about. And I'm just thankful y'all doing this, and I appreciate all that you are doing.
Oh, good. Well, thank you.
Yeah, thank you. So see, it's easy. It's easy to get involved. I think people get intimidated, but you know, Jen did her research. She signed up for the bill tracking, like she said on, I think it's tn.gov website. And you can also sign up for our advocacy network at namitn.org. So I'm going to stop there. Let's see if there's any comments. Yeah, so I know we're getting close to 5 o'clock Central and wanted to see if anybody had any questions as we wrap this up. Oh, Jen, so you would love to see peer respites in Tennessee. Can you explain what that means?
Yeah, so there are, I think the closest state that has peer respites is Georgia has 5, I believe. You can get on like peerrespite.com, explains a lot about it. Run by peers, like folks with lived experience, so run 24/7, kind of like almost like a crisis stabilization meets like more of like a home feel. It's like when you were talking about people just don't know what to do with their loved ones, right? Like they're not actively suicidal. They don't actively have a plan, but they're having extreme beliefs or experiencing extreme beliefs. They could go to peer respites where they could spend time and like someone cooks for them, someone helps them, you know, through their daily like life. There are some needs for like you because of legality, right? Like they have to be able to give themselves their own medication, right? Because they don't have a nursing staff. Right, yeah. So there are a few things there, but there's 5 in Georgia. It's all peer run. I just because families don't know what to do, right? And people are sitting in Vanderbilt ER for 2 days just to be turned away because they're not actively suicidal. They don't have a plan. They're full. And, you know, so going to a place that is more homey, that isn't chalked with fluorescent lights, that doesn't have, you know, they are very trauma informed because they are run by fellow psych survivors. I'd love to see something like that in Tennessee. That's like a big dream and hope for me. So.
Well, good.
Yeah. And that's where it starts. It starts with a dream. It starts with an idea. And the best time to be talking about these kind of dreams and ideas is over the summer and talking with your legislators. So, and again, please visit our website for tips on how to get in touch with your legislators. We've got our recorded webinars on namitn.org. So this concludes our Advocacy Day series. We hope that you found this informative. I want to thank Bill Dobbins for helping me walk through the many areas of legislation that we cover on behalf of individuals affected by mental illness. And thank you for all you do in the advocacy world on behalf of yourself and your family members.
Yeah. Thank you.
All right.
Thank you.
Bye, everybody.
Bye-bye.
Bye.
Bye.